Yes, sir. Can we start? Very good morning to all. I, Renuka Pawar, wholeheartedly welcome you all on behalf of the organizing committee at Bharati Vidya Bhavan's Sardar Patel Institute of Technology on the 8th day of AICT sponsored 2-week online faculty development program on data science and its application. I take this privilege to warmly welcome Professor Dr. Mayuri Mehta. She is currently a professor and PG in charge in SCET Surat, Computer Engineering. Ma'am has 20 years of experience in the teaching field. She has published more than 30 papers in various international journals, conference of repute. Ma'am has delivered many expert talks, conducted workshop tutorials in AI, ML, and healthcare related domain. She is a member of IEEE, IST, and CSI. Her area of expertise include data science, machine learning, deep learning, health informatics, computer algorithm, Python programming, research methodology, distributed computing, genetic algorithm. Once again, I welcome you, ma'am, and may I request you to take over and start the session, please.
Once again, this is not clear. Problem, ma'am. Right during the first starting.
Madam, you log out and log in again. Your voice is not clear. Ma'am, you stop presentation, log out and again log in.
Let me log out, sir, and then I'll log in again. No. Okay, sure. Sir, are you getting my voice now?
Ye-
Yes.
Yes, madam, but it was very.
It's breaking.
You have to say one complete sentence. Ma'am, you share the screen and let us see once again. Oh, no. The screen is visible, madam, now.
Okay. Can you hear me now?
Yes.
Okay, fine, sir. Thank you very much. I'm very sorry. Okay, good morning, everyone. First, I would like to thank Surendra sir for providing me opportunity to share my insights about AI for healthcare. I would like to tell you that information which I am going they are collected from various resources and they are also from our own research work, and this contents are for information and education purpose only. And domain. I have divided the flow of my presentation in 4 major parts. I will start with emergence of artificial intelligence. Then I will introduce key application areas of artificial intelligence in healthcare sector. After introducing key application areas, considering the remaining time, I will discuss two get most out to get most out of, you should have basic learning. So you might have machine learning, deep learning, or I don't. Specific learning and deep learning. A slide AI, machine learning, then deep learning, and then I will see in healthcare. Okay, so everyone knows artificial intelligence would intelligence demonstrated by machines in contrast to the natural human. And this AI, many people they take this AI similar to data science. Tell you that this artificial intelligence and data science, they are not same, they are different. And as we know, data science has revolution today in almost all. Artificial intelligence, it is used in the field of revolution to and aware of learning beyond. Learning, natural language processing, expert system, etc. Now, among the domains, this machine it has received wide popularity in several domains. It is because the wide popularity and it is used.
Ma-
Mayuri ma'am, one second. The voice
Mayuri madam,
voice is breaking.
Mayuri madam, can you hear us?
Yes, I can
Mayuri
hear you,
madam,
sir.
yeah, again
You
voice is
cannot hear me,
breaking. Means
sir.
it is breaking continuously. Means some problem is breaking continuously.
Switch to another lab. I'm in one lab. There may be problem in network connection. So please give me 5 minutes. I'll switch to another lab and then I'll start.
Yeah, that will be okay. That we will wait for 5 minutes. No problem, ma'am.
Hello. Can you hear me or still my voice is breaking, sir?
Yes, ma'am.
Now?
Yeah, well, I can hear you, but then I don't know whether it will break again or not. Your voice. You changed some device or what?
Okay. No, I have changed device, but I have changed the place, uh, and I'm using the other
Acha.
internet connection.
Now voice is okay.
So now voice is okay. Now, hope participants can hear me now.
Madam, can you monitor chat box?
Hello.
Madam, are you able to monitor the chat box?
Yeah.
Then you can see the chat box frequently.
Okay, I think they can hear me now. So let me start. If you face any difficulty, please let me know message in chat box. So we were discussing the evolution of artificial intelligence and the various subdomains of artificial intelligence. And as we have discussed, amongst these subdomains, machine learning has popularity because machine learning is used in several domains of real sector. Okay, the machine learning actually includes statistical techniques which give computer system ability to automatically learn and steadily improve their performance from their experience with the data. So as we increase the amount of data, the learning and accuracy of machine learning model increases. So this is all without being explicitly programmed to do so. And this machine learning, it is used everywhere for automation. So you may already be using devices and applications which use machine learning. For example, you Alexa, Google Home, which are virtual personal assistants. These are machine learning based devices. You a few more examples of machine learning based applications. For example, suppose you want to go from one place to other place, and before you start, you can see that how much traffic is there on the route via which you are planning to reach to your destination. So this is also possible because this has also been possible because of machine learning. Earlier, did you ever thought that we will say, okay, Google, hey Siri, and in return, somebody will speak with us and it will do as we want them to do. So we never imagined that. Almost 10 years ago, a year ago, we used to rely on all manual ways and to fulfill our objectives and never imagined that in this era we will be using machine learning based applications. So machine learning today is used in almost every sector of our real life. This deep learning it is a subset of machine learning, and it comprises of algorithms that permit system to train itself to perform tasks by exposing multi-layered neural networks to a vast amount of data. So deep learning models, they can achieve a state of the art accuracy. Sometimes they exceed human level performance, and most deep learning methods, they are based on they use neural network architecture, and they only involves 2 to 3 hidden layers, while this deep network can have as many as 150 hidden layers. And the deep neural networks are RNN and LSTM, short-term memory networks. Right? And this deep learning, it also has starting from automated driving to medical devices. If we is starting from this. If we go then on this, then etc. In economic is used etc. Used to pedestrians which have to of the applications of deep learning. To regions of team, etc. Starting to do okay, not getting my voice or getting my hello.
Yes, madam, you are audible.
Hello.
Hello. Yes, ma'am.
Yes, you are getting my voice now, sir. I am talking.
I don't know. Still, your voice is breaking. Now, still, it is breaking. I think so.
Still, it is okay. Uh,
Madam, you are headphone
yeah,
problems? Some headphone or what you are using?
no, I'm not interested. Now I'm switching to some other. Now again, I'm switching to different lab. There is department. Lab. I'm not using headphones, sir. No, to different. Uh, no, I'm not using
Hello. हेलो मैडम, आप माइक म्यूट है।
Hello.
हाँ मैडम, ओके, यस यस, यस
Hello.
यस
Yes.
मैम, वी कैन
Okay.
हियर यू।
AI part, and I assume that all of you have basic understanding of machine learning and deep learning. So let us switch because due to technical problem, our session is delayed by almost half an hour. Okay, so I'll skip this part. Okay, these are the various applications of artificial intelligence, which also I will skip, but you can observe here that they are used in various real life sectors, like they are used for self-driving cars, they are used for news aggregation and fraud news detection, natural language processing, to provide virtual assistant. In entertainment also they are used for disease diagnosis and drug discovery. Also artificial intelligence is useful for speech recognition, image recognition, etc. So these are the various applications of artificial intelligence. Okay, now here I would like to let you know that how artificial intelligence has evolved and it has emerged in healthcare. There are three major reasons due to which artificial intelligence has emerged in healthcare domain. The first and foremost reason is availability of a high amount of electronic healthcare data. So with ever increasing use of computer systems, the digitization of all medical records, it has become a standard today and it is widely adopted practice nowadays. And hence digital healthcare data is available in immense volume today, and it includes a variety of health data which are generated by health related systems and devices. So this term electronic health records, it was actually coined in 2003 to represent the records that are maintained for improving the healthcare sectors towards the benefit of patients and clinicians. And over the period of time, the adoption of this electronic healthcare record systems, they have increased, this adoption has increased worldwide, and it has made it possible to capture a large amount of clinical data, which ultimately resulted in big data. So with this big data, we can take advantage of artificial intelligence. Okay, there are several advantages of electronic healthcare records. So before we discuss the other two reasons, let us see what are the advantages of using electronic healthcare data today. The first advantage is that healthcare professionals have access to the entire medical history of patient. The information includes medical diagnosis, then prescription, related data. Then it also includes demographics, clinical narratives, various laboratory test reports, etc. And this information help doctors to recognize and treat medical conditions in less time. The second advantage of this electronic healthcare records is significant decrease in redundant and additional examinations. It also decreases, there is also decrease in lost records and ambiguities which are caused by unreadable handwriting. And the advantage is that doctors, they have an improved care coordination between multiple healthcare providers. The next advantage is that they have found access over web-based and electronic platforms to improve their medical practices using automatic reminders and notifications regarding vaccinations, disease screening, other periodic checkups, etc. So due to this, there would be a greater continuity of care and timely interventions by facilitating communication among multiple healthcare providers and patients. The next advantage is that it provides faster data retrieval. This electronic healthcare records, they enable faster data retrieval. They also improve public health surveillance by immediate reporting of disease outbreaks. The next advantage of using this electronic healthcare record is that they enable, the next advantage is that they can reduce or absolutely eliminate delays and confusion in billing and claim management. So these are the various advantages of using electronic healthcare records, and that is why they have, this practice has been adopted today by most of the hospitals. This healthcare electronic health record internet, they together provide access to millions of health related medical information, which is critical for patient life. Let us go go back to that slide and see the other two reasons that why artificial intelligence has emerged into healthcare domain. A huge amount of health data which is available today due to this electronic health data does not make any sense until you truly transform this healthcare data into knowledge. So to transform this data into knowledge, substantial additional computation power and new data mining and natural language processing techniques are required, and they are key components to analytics. So these are the other two reasons that how this artificial intelligence has emerged in healthcare. Along with this massive amount of data, today we also have increased computation power, and we also have rapid analytics algorithms using which we can analyze this enormous amount of data, and to process this enormous amount of data we can use this increased computation power which is available today. So these are the other reasons. So earlier too, healthcare data was available. However, it was not available in electronic form. Hence, although AI techniques are available since 1915s, they were not so popular earlier, and they have been so popular today because today we have data available in digital form, and we can analyze this data using artificial intelligence techniques, because as we all know, this artificial intelligence techniques, they have potential to analyze complex data. So now data available in electronic form, and hence a lot of research is being carried out in this area today by researchers of technical as well as medical sectors. Using machine learning and deep learning techniques, these machines are made to learn the various patterns from this healthcare data, including symptoms, behavior, biochemical and pathological variables, etc. And due to this, as a lot of research is going on in this area, the big tier companies like Google, Amazon, IBM, Microsoft, GE Healthcare, they are investing billions for AI in healthcare, and hence AI related job market in healthcare sector is growing extremely rapidly. Not only this electronic healthcare data is the reason for the emergence of AI in healthcare, the other reason is, as per the economic survey carried out in 2019-20, it was carried out in January 2020. This economic survey has released information regarding the shortage of doctors in our country. The doctor population ratio in India is to 1456 against the WHO recommendation of 1:1000 in India. So as per this, you can observe that India has 6.8 practicing doctors per 10,000 population as per this ratio, but the minimum doctor to patient ratio recommended by WHO is 1:1000. So this indicates that we are laced by almost one third of required doctors in India, and AI is useful here to build automated healthcare systems which will assist doctors to provide improved healthcare services. Now here I would like to tell you that you please remember that this AI technology is to assist doctors, it is not to replace them. It is doctors, it is not to replace them. It is said that machines will not replace physicians, but physicians using AI will soon replace those physicians who are not using artificial intelligence, because AI is to make medical process faster and cheaper, and use of automated healthcare system makes clinicians more efficient and productive. It reduces the load on medical professionals. For example, let me give you simple example. It helps in early detection. This artificial intelligence techniques can be used for early detection of various chronic diseases like Alzheimer, diabetes, cardiovascular diseases, and various types of cancers like breast cancer, colon cancer, etc. Okay, now this AI techniques, when it is useful for early detection of chronic diseases, early detection reduces economic burden on patient, and it also helps in controlling disease progression. Moreover, automated healthcare system helps to minimize errors. So this AI is very useful in healthcare sector. Another reason for emergence of AI in industry is generation of enormous data through IoT networks in healthcare. Using IoT, a regular hospital can be turned into a smart hospital wherein everything is tracked and managed simultaneously while all the data is collected in a centralized database. In multidisciplinary hospital, you can imagine the amount of data which is generated regularly if it is turned into a smart hospital, because it is a multidisciplinary hospital wherein a number of patients are supposed to visit that hospital daily, if they are providing services for different types of diseases, then you can imagine the amount of data generated regularly if a hospital is turned into smart hospital. This is the traditional way of healthcare. As we all know, doctor, they need to attend the patient for treatment. And sometimes there is delay in the treatment in critical condition in absence of healthcare support staff. And involvement of sometimes multiple stakeholders is required when it is related to critical disease. And much interaction among there is no much interaction among the stakeholders due to decentralized system. So this is the traditional way of healthcare. But on the other hand, if we use IoT enabled solutions in healthcare, then they facilitate continuous generation of data, and that is they generate big data, which offers a lot of benefits using artificial intelligence on various levels of healthcare system, starting from in care health condition monitoring to decrease to disease prevention and early diagnosis. All these facilities can be supported if we turn hospital into smart hospital. Let me give you example of one IoT use case in healthcare. Probably you might be knowing about that if you have heard. In 2018, NHS England, which is an executive non-departmental public body of the Department of Health and Social Care, announced that it is willing to support a remote diabetes treatment solution. So this statement was made on World Diabetes Day in 2018, and the solution is continuous glucose monitoring using a device that is the size of a penny. This device glucose level non-stop after it is inserted in a patient's arm. And the monitoring data can then be easily accessed via your Android or iOS device. And such smart health monitoring devices, they produce a huge amount of data, and they bring huge value to the research and treatment of diabetes using artificial intelligence techniques. So such several examples are there that today we have a huge amount of data, and due to which the artificial intelligence has emerged in this care sector, right? Okay, fine. So now let us see the workflow of data analytics in healthcare. This is the workflow of big data analytics in healthcare. Warehouses, as you can see in this figure, data warehouses store massive amounts of data generated from various sources, and this data is processed using analytics pipeline to obtain smarter and affordable healthcare options. Right? So I hope this is clear. This is simple workflow of data analytics in healthcare domain. Now I shall briefly introduce various application areas of artificial intelligence in healthcare. There are several applications of artificial intelligence in healthcare, but here I have included key application areas of artificial intelligence in healthcare. Artificial intelligence is used in healthcare for drug discovery. It is used for treatment design, medication management, medical image analysis, for healthcare system analysis, for clinical decision recommendation, for robot assisted surgery, and genetic and genomic based research. I'll simply introduce each of this application domain in brief because these are huge concepts and they cannot be fully covered within the limited time. So starting with this drug discovery, let us discuss each application area one by one in brief. Today, pharma industries, they have joined hands with artificial intelligence industries, AI industries, to and modernize the clinical drug development process. Let us discuss the traditional drug discovery process. It has been reported by California Biomedical Research Association that a drug completes a long journey of 12 years to reach the marketplace from research laboratory. Moreover, merely 5 drugs in 5,000 drugs are permitted for human tests, and one in these 5 drugs is permitted for human treatment. I repeat, 5,000 drugs are permitted for human tests, and one drug in these 5 drugs is permitted for human treatment. In addition, the estimated cost of developing a new drug is approximately US dollar 360 million on average. So machine learning and deep learning techniques are useful here in streamlining the drug discovery process, and more importantly, they are useful to cut down the cost of discovery and the time to reach the marketplace. As you can see in this figure, the key steps involved in traditional drug discovery process, they flow among the steps. This figure shows you the traditional drug discovery process flow among these steps, time required for each steps. Here you can see that the 6 steps are involved in traditional drug discovery process, and here I have mentioned the approximate time required for each of this drug discovery step. As it can be noticed from this figure, the majority of the time of the drug discovery process, it is consumed by step number 6, clinical trials. Here you can notice that it takes around 6 years, and that's why it is for when any new disease during this pandemic, it has not been possible to discover a new drug because the traditional drug discovery process, it takes around 12 years. So if correct pairs of compound molecules and targets are identified during the first 3 steps of this traditional drug discovery process, a lot of time can be saved in clinical trials. That is, a lot of time can be saved in this 6 number step. If we use machine learning, deep learning during the first 6 steps to identify the right compounds, right molecules to create the drug. Machine learning, deep learning methods, they play a vital role in discovery of previously unknown, however, effective pairs of molecules and corresponding targets in the first 3 steps. This shows the process of matching chemical properties. These are the methods. Here I have shown you some methods which have been created using machine learning. These are the methods to discover DTIs. DTI is drug target interaction. DTI stands for drug target interactions, and a process of matching chemical properties of compound molecules with target markers and finding the effective pairs is known as drug target interaction. And for this process, machine learning has been used. We have in literature supervised as well as semi-supervised concepts have been used for DTIs, identification of drug target interactions. And these are the various methods available in literature. Here I have included popular data sets available in this drug discovery domain. So machine learning, deep learning methods can be applied to this chemical data sets. A lot of information about different molecules is available in this data sets, and they contain thousands of molecule information. And these are open source data sets. They are available, they are publicly available for drug discovery. So if anyone wants to carry out research in drug discovery domain using machine learning, deep learning, they can explore this data sets in deep. Okay, the next application area is treatment design. This is application area. Let us see how artificial intelligence is useful in treatment design. Okay, in current scenario, one treatment fits all. One treatment, it fits all patients, one medicine for all patients, irrespective of severity of disease. However, for better outcomes of medical treatment, treatment should be tailored to the characteristics of the patient and individually customized treatment should be designed. In spite of giving the same treatment to all these patients, right, without considering, irrespective of considering the severity of disease, the body structure of patient, we are giving the same treatment in several diseases. So it has been recommended that treatment should be tailored to the characteristics of the patient and individually customized treatment should be designed. So artificial intelligence has a profound effect in designing such individual customized treatments, and in future personalized treatment will be given to individual patients. It has been observed that different patients, they respond to drug treatment schedules differently. Here I have included diagram to show that how different patients respond to drug differently. As you can see in this diagram, some patients they respond to normal dose of the drug. Some patients they respond to lower dose of the drug. Some patients they respond to higher dose of the drug, while some patients they do not respond to drug and they need alternative drug. However, in many cases, like in cancer treatment, we are giving the same therapy treatment, sometimes same dose, irrespective of body structure of the patient and severity and other, we do not consider other factors. So personalized treatment has enormous potential to increase patients' lifespan. And however, the challenge in this domain, in personalized treatment design, the challenge is it's very hard to identify that which factors should affect the choice of treatment. So this is the challenge and this should be addressed to provide the personalized treatment design using artificial intelligence. Here I have included some examples of research in this personalized treatment design domain. Here you can see that the Aalto University and University of Istanbul in Finland, they have developed a new artificial intelligence technology that can compare different treatments and they can identify the most suitable alternative for a patient using artificial intelligence technology. Another research is the doctors and another research is a team of University of Toronto, Canada. They are working, this team is working to significantly reduce the time needed to develop radiation therapy treatment plans for cancer patients. Moreover, doctors geographical locations, they discuss and differentiate between the treatment plans and they can identify the most suitable option for the patient using supporting statistics and they can identify suitable option for patient using supporting statistics and analyzed evidences. Moreover, natural language processing has been used to analyze unstructured text such as medical notes and reports to assist clinicians to select and recommend the correct, dynamic, personalized treatment for complex diseases. So this kind of research is going on in this domain of healthcare sector using artificial intelligence. Application area is medication management. Poor obedience of patient towards taking suggested medicine is a widespread problem, right? We tend to disobey doctor's suggestions, right? Many times it happens that doctor prescribes medicine for 1 month and we take medicine only 15 days. Sometimes it also happens that doctor prescribes a dose of say 600 units and in market if we find a dose of 500 or 400 units then we go for that medicine. So this is very common in among the population that patients they tend to go against the doctor's advice and this leads to poor health outcomes and inflates healthcare cost. So artificial intelligence techniques, they have been used in different ways to improve medication management. It is used to increase medication safety. It is used to accurately and cost effectively estimate risk and consequences across a large population. It is used to decrease time and cost. It is also used to supervise medication adherence, and it is also used to plan follow-up appointments to evaluate treatment progress. Let me give you one example for this medication management. The National Institute of Health, it is known as NIH. It has developed an AI cure application for smartphones to monitor and supervise medication usage of patients. So, AI algorithm with smartphone's camera, and AI algorithm which is integrated with smartphone camera, it autonomously check that patients are taking medicine as per prescription or not. And this application, this AI core application, it assists doctors to manage a health condition of the patient. Such applications are highly useful to patients with severe medical conditions and patients who tend to go against doctor guidance. So for medication management, AI is very useful. This is example, actually this is sense.ly. This is sense.ly. It is known as Sensely. It is the popular virtual. It is used for medication management in United States. It checks with the patient. It checks with the patient once or multiple times a day. This application checks with the patient once or multiple times a day, and it can ask the patient to check their vital states such as their weight, blood pressure. This application can ask patient to give feedback, and this application can ask questions pertaining to their medical condition. The embedded AI technology records the results that is then funneled back to the physicians. And patients can communicate with nurse by clicking on the options provided on the screen. So this Sensely can communicate with the healthcare providers by calling and scheduling on behalf of the patient. So these are the steps for using this Sensely, that once the patient is discharged, patient is enrolled in this application, then patient follows prescribed regimen and monitoring, and then clinician if risks have increased or they stay high. Then clinician follow-ups via video or coordinates specialist, and then patient keeps getting better, clinician gets reimbursed. So this is a win-win situation for doctors as well as patients, and this kind of virtual platforms are very useful for medication management, and these platforms have been created using AI technologies. Here you can see that this is how, this is another example, MediSafe application. It is also used for medication management. This MediSafe is a mobile app, Israel's personalized medication management platform. Sensely is highly used in United States. This MediSafe is used in Israel. Sensely and MediSafe, they both are startups which use AI and machine learning. This startups. MediSafe passively collects data from patients such as prescribed medications, health measurements, and it uses self-learning algorithms, which can, self-learning algorithms means here machine learning is used. So self-learning algorithms are used by this MediSafe application, which can help patient adhere to instructed medication better. Once the patients download this MediSafe app, they will be reminded whenever they need to take their medicine. So here you can see that I have included screenshots that the patients, they get reminders regularly. Users can then either enter the doses on the app and when and how they are taking their medication. So if users enter this information in this app, the reminders along with this doses information, time, etc. will be given, that what type of medicine patient has to take, in what amount they have to take, etc. This information will be given via reminders to patients. The information can then be easily shared with caregivers and doctors too, right? So this is how this MediSafe application look like, right? Applications are popular for medication management. You will find a lot of such applications in literature. Here I have included some more such applications which have been popular, right? This is WebMade. This application, it is a symptom checker, physician directory. It provides the services. It can be used to check symptoms. It can be used as physician directory. It can be used to check medical conditions, right? So moreover, we also have other such applications, ADA AI Doctor. This application was launched in 2016 and today it is used across 140 countries, and it helps the user to understand his health better, and further it helps user to further manage his symptoms. This is Huku.ai. This is easy to use messaging system. It determines the best care plan for a patient. This is skin vision application. This application helps patients to detect skin cancer using AI. It takes 30 seconds to report risk of skin cancer. So once it is detected, the further treatment can be given and further investigation can be carried out. This is Sensely, this is Bina.ai. So such several applications are available for medication management today, and all these applications are AI powered applications. Okay, this is next application area. Next application analysis, right? Medical image analysis. This is widely explored area for research. Medical image analysis is useful for detection of disease states. For example, it can be used for detecting lung cancer or strokes based on CT scans. It can be used for assessing the risk of sudden cardiac death or other heart diseases based on electrocardiograms and cardiac MRI images. It can be used to classify skin lesions in skin images. It can be used to find indicators of diabetic retinopathy in eye images, etc. So such several uses are there. Different types of medical image modalities are there, and based on that, a lot of research has been carried out in this area. Okay, now here I have included the different types of medical image modalities. Different medical image modalities are available, and they are mainly divided in this two categories: radiology and visible light photography. Radiology and visible light photography. Visible light photography is further divided into subcategories like microscopic image, dermoscopic image, endoscopic image, right? And this radiology images are of this types: X-ray images, CT scan, MRI, ultrasound, thermography, SPECT, PET, etc. Right? So these are the different image modalities, and here I have included the sample of each of this image modality. Here you can see this is X-ray, this is chest X-ray, this is chest CT scan, this is brain MRI scan, this is kidney ultrasound, example of thermography, breast thermography image. This is example of SPECT image. This is brain SPECT image. This is PET scan. It is of lung, right? This is microscopic blood cells, endoscopic view, and this represents dermoscopic images. So these are the different types of medical image modalities available. Now, even if you focus on any one of these subcategories, right, enormous research opportunities are available using artificial intelligence. For example, if we focus on the simplest image modality, say X-ray, we know that several diseases can be diagnosed using considering this one type of image modality, X-ray. X-ray is used to diagnose bone-related diseases. It is used to diagnose TB. It is used to diagnose pneumonia, corona, etc. Right? So even if you focus on, you can collect chest X-ray images. If you want to create an automated system to diagnose TB, right? Then you can collect you can collect chest X-rays of TB patients. You can train your machine learning model, and you can make an automated system that will be useful for future patients to diagnose TB. So enormous research opportunities are available for each of this image modality. Here I have included another example. If we focus on ultrasound image, just we discussed that enormous research opportunities are available if we focus on X-rays. Focus on ultrasound image. Ultrasound images are useful to diagnose brain organs. They are useful to diagnose stomach organs or digestive system organs, etc. So even if you focus on ultrasound image, they are useful for diagnosis of digestive system. And as we know, digestive system comprises of several organs, such as you can see that these are the major organs of digestive system: stomach, small intestine, large intestine, pancreas, liver, gallbladder, etc. Right? So different types of diseases are there related to each of this organ. Different types of diseases are there for small intestine, for large intestine, and we can create an automated system to diagnose those diseases using ultrasound image of digestive system. So thus enormous research opportunity is available in this domain of healthcare using machine learning, deep learning techniques. This is the sample machine learning, deep learning based model to diagnose disease using ultrasound image modality. Suppose you have ultrasound image modality. Sorry, you have suppose a set of ultrasound images of say digestive system. Apply this steps, right? These are the data science steps. You can apply, you can use pre-processing on this set of images. Then you can perform feature extraction using convolutional neural network or some other technique. And then from extracted features, the decision can be taken that whether the patient is suffering. Once the model is trained, the trained model can be used for a new ultrasound image to check whether patient is suffering from disease or not, right? So this is how this images are useful to create automated systems using artificial intelligence. This is popular application in this area. This is Google's AI algorithm that predicts heart disease by looking at your eyes. Google discovered a new way to assess a person's risk of heart disease using machine learning. By analyzing the scans of back of the patient's eye, by analyzing the image of patient's eye, the algorithm is able to accurately deduce data such as person's age, blood pressure, whether person is smoking or not. And this information can then be used to predict the risk of suffering a major cardiac event such as heart attack. So with roughly the same accuracy as current leading methods are giving, this algorithm is performing. And this algorithm is predicting all this information, analyzing the back of your eye. The algorithm potentially makes it quicker and easier for doctors to analyze a patient's cardiovascular risk, as it does not require blood test, right? Research done by Stanford University in medical imaging see that in 2017, a group of Stanford University, they tested an AI algorithm against 21 dermatologists on its ability to identify skin cancers. And the clinical findings, as reported by Springer paper, it has been reported in the Springer paper that this algorithm achieves performance on par with all tested experts, and it demonstrates an artificial intelligence is capable of classifying skin cancer with a level of competence comparable to dermatologists. So here also artificial intelligence is used to classify this skin lesions and to predict whether patients are suffering from skin cancer or not. The next application domain is healthcare system. The okay, AI techniques are used in a number of ways to analyze this healthcare system. thereby to provide solutions that save time, that reduce cost, and that increase accuracy. So they are used to analyze a wide range of data throughout a healthcare system, to mine and to automatically predict the processes. Examples that how AI has been used for healthcare system analysis. See that healthcare invoice generation in Netherlands, and 97% of healthcare invoices are electronic, that allow both invoice delivery and payment, or both invoice delivery and payment to take place online. So which in turn, this in turn increases efficiency while it reduces the cost. Another example is a Dutch company uses artificial intelligence to highlight mistakes in treatment, to highlight workflow inefficiencies, and to help area healthcare systems to avoid unnecessary patient hospitalization. IBM Watson physicians in being able to analyze thousands of medical papers using natural language processing to identify treatment plans. And the next example is about 25% of healthcare cost in United States, they go towards billing and usually for insurance too. So this application, yes, it can coordinate between patients, insurance companies, hospitals, specialists, and banks to keep human intervention to a bare minimum in this process. So intelligence in healthcare system analysis. I recommendation. Capability to provide context-relevant recommendations. These recommendations are provided to patients' friends, and family, and the hospital team through a variety of tools. Recommendations can be provided via mobile apps, via wearables and chatbots, etc. And such AI-driven tools, they assist people to be in charge of their health. So with the right data, integration methods, and personal place, machine learning has the potential to advance clinical decision support, and machine learning has potential to help providers. Machine learning is useful for recommendations also, and these recommendations can be provided to different to different people like patients, patient friends, patient family members. Assisted robotic surgery is also a highly area for research. These robots have been used in medicine for more than 30 from simple laboratory robots to complex surgical robots that can surgery can they are so the robots are used they also use for ENT therapy for those with find services in healthcare domain. Or they can give doctors, they can give precision, they can give flexibility, and they can also control and perform performing complex, minimally invasive procedures. Benefits of assisted surgeries are patients will if the surgery is performed using robots, then
Hello. Hello. Yeah. Madam is no respond. Yeah, Mayuri madam.
Network problem. So
Yes.
hello.
Yeah, ma'am. It's now screen is visible.
Yeah, it's fine now.
Yes.
Okay. Thank on this slide I was and I got disconnected. I think I was discussing this part.
Yeah, you start from here, ma'am.
Hello.
Yeah, go ahead, ma'am.
Hello.
Yes, I can hear you.
Am I audible now, sir?
Yes, ma'am, I can hear you.
Okay. Okay, there is echo. Okay. Still you are getting my echo? Okay, fine. Let me start. If you okay, now fine. Okay. Okay, so we're discussing about the robotic surgeries, and these are the types of surgeries which have already been performed using different robots. These are the surgeries which have been performed using Summerlin Hospital in Las Vegas. These are the various types of surgeries which have been performed by Mayo Clinic, and these are the surgeries which have also been performed. Okay. This here you can see that this is Da Vinci robotic system, which is very popular all over the world, and majority of the robotic surgeries have been performed using this Da Vinci robotic system. This figure shows the heart related surgery which has been performed using this system. Example where robots can be used. This is the spine robot developed by S.P.I.T company, and as you can see that this robot which is developed by Israel country, it performs spine surgery with accuracy 98.9%. And these are advantages of using this spine robot. The advantages are it reduces average length of hospital stay by 27%. The complications rate is also reduced by 48% when spine surgery is performed using this robot. It also reduces revision procedures by 46%, and the post-operative infections are also less if the spine surgery is performed using this spine assist system. which is developed by Major Robot Company in Israel. Okay. Hello.
Yes, madam, you are
Hello.
there. Yes, madam, we can hear you. Continue.
Can you see the next slide?
Yes, ma'am.
Okay, so the next is genetics and genomics, wherein for which AI techniques can be used. This genetics and genomics is an emerging subdomain of healthcare, wherein AI, especially deep learning algorithms, has plethora of uses. Genetics and genomics data sets are complex and large in deep learning methods are more suitable to process them to facilitate drug target identifications and development of new remedies. So analyzing this genetics and genomics using artificial intelligence, mainly the new medicines are developed and new remedies are also identified. Diagram shows the use of deep learning in genomics. In our body, we have hundreds of tissues. You can see that our body has hundreds of tissues. And these are the three-dimension information that give us a huge amount of data for these tissues. When we have a huge amount of data, we always prefer deep learning to train our models. And if we train this model with a large number of patients' information, this is the information related to one patient. Related to one patient, we have a huge amount of data because there are hundreds of cells in our body, and related to each cell, three-dimensional information is available. So even if we consider only one patient, huge amount of information is available. And if we consider several patients, and if we take their genetic and genomic information, we can later use, we can apply artificial intelligence techniques. We can train model with this large amount of patient information, and we can later use it for fast discovery of drug and for disease diagnosis. This figure shows use of histology, use of histology and genomics for cancer outcomes. Cancer, different types of cancers can be predicted considering histology information and genomic information. And here I'll show you an example that this is the latest research carried out in this domain, that 12 types of cancers can be identified using genomic information. So this genomic and genetic information has a lot of potential to carry out research using artificial intelligence to identify new therapies and new drugs in healthcare domain. About the different domains, application domains in healthcare, that can apply artificial intelligence to analyze data, and we can develop new drugs, we can predict diseases, we can diagnose diseases during early stage. We can also create applications uh, uh, we can create applications to monitor health condition of the patients. Telemedicine is also there. So these are the different application areas of artificial intelligence in healthcare. Now, I would like to discuss 2 to 3 AI powered health. I think we have yet 1.5 hours. Sir, is it required? Disturbance and session is already delayed. However, if participants need break, we can take 5 minutes break and I can start this topic.
We can ask them.
Uh, yeah, no break is required. discuss various application of artificial intelligence in healthcare. Now, each of the application area is vast, and you can go in depth in each. Now, let us see some healthcare solutions which have been developed using artificial intelligence. These solutions have been created by my research scholars under my guidance. So, I have included here three applications: craniofacial distance measurement for facial reconstructive surgery, computer-aided dry eye disease detection using deep learning, and the third is early detection of hypothyroidism in infants. Okay. Looking at the title of this application, that is craniofacial distance measurement for facial reconstructive surgery, the first question that may come to your mind is, what is craniofacial? Right? Let me tell you what exactly the craniofacial is. In craniofacial, cranio means head. Cranio means head or skull, which encloses the brain. It is head or skull that encloses the brain, and facial here refers to the facial structure. So craniofacial refers to the head and parts of the face. It refers to the face, and it refers to the head and parts of the face. The term craniofacial is typically used to describe an area of focus for treatment of certain congenital defects, which are known as birth defects. They are also known as abnormalities, birth abnormalities, or they are used to represent the facial injuries. Craniofacial distances, they are required to be measured for surgeries related to craniofacial disorders. For example, suppose a person has met an accident, and suppose the nose of a person is ruptured. So to reconstruct the nose, distances related to nose are required to reconstruct the nose of that person. So craniofacial distances are required to be measured for surgeries related to craniofacial disorders. And craniofacial measurements, they include two types of measurements. They include linear measurements and angular measurements. For example, you know that we have angles also. There is an angle between eye and both eyes and nose. There is an angle between upper part of mouth and nose also. So these angles are required to be measured when these surgeries are to be performed. They are typically measured considering primary and secondary landmarks on our face. We have 7 landmarks on our face. These are the 7 landmarks. 2 endpoints of the eyes. So total 4 landmarks. This 2, 4, right? Nose tip, it is also considered as one landmark. And 2 end 7 primary landmarks, but if we consider secondary landmarks, we have 61 secondary landmarks on the face. So total 68 landmarks, 7 primary landmarks, 61 secondary landmarks. Why secondary landmarks are considered on our face? Because secondary landmarks, they help us to measure precise distances of different parts of our face. Using this primary landmarks, we will not get the precise distances, so secondary landmarks are also considered. These measurements are required to be measured for facial surgery to construct as similar as possible original face. Actually, surgeons, they do not have any or facial features like eyes, eyebrows, ear, nose, cheek, mouth, chin, forehead area, jawline, because these features, they are different from person to person, right? Two persons, two people, they have different measurements for eyes, they have different measurements for eyebrows, they have different measurements for nose, and that we all know. And they are highly dependent on, these measurements are highly dependent on racial category and geographical area in which person lives. Here you can see that these two people, they belong to different geographical area, and their facial measurements, their facial features are different. Right here you can see that the length of face of this person is different from the length of this person, because they belong to different geographical area. They belong to different race categories, ethnical group, right? Let me give you a very simple example that craniofacial measurements means measurements of different parts of our face. These measurements, they are different for Chinese people and Indian people, because Chinese people and Indian people, they are different. They have different facial features. Even if we consider only our country, say India, right? Surgery for North Indians and South Indian is different due to different facial features. And we know that South Indians and North Indians, they have different facial features. Okay. Facial surgeries, actually, they are broadly classified into two major categories, aesthetic surgery and craniofacial surgery. And our focus is on craniofacial surgery. Aesthetic surgery is described as a facial plastic surgery. This is related to bones, and this is aesthetic surgery. It is plastic surgery related to bones. And craniofacial surgery, it is related to different regions of the face, and they deal with soft tissues on our face. And they have different names in medicine. If surgery is related to nose, it has different name. If the surgery, craniofacial surgery, is related to eyelids, it has different name. If it is related to skin on face, it has different name. If it is related to cheek, lip and chin, then it has different name. So these are the different names of facial surgeries related to different parts of face, and our focus is on craniofacial surgery. And here you can see that to reconstruct this part of nose, facial surgery needs to be performed. So you must be wondering that why these measurements are required. Yes, these measurements are required if we want to reconstruct this part of face. Mouth related measurements are required if we want to reconstruct this part. If we want to reconstruct this part, facial features like what is the width of this, we can construct similar part here. We can see that this part is available. We can take measurements of this part and it's symmetrical parts on this side also, and we can reconstruct this part of this person, right? So facial surgeries are performed for several reasons. Okay, now this is the motivation for our problem which we are addressing in this research. Typically these measurements are taken using this physical instruments and using this protector. To perform craniofacial surgery on patient's face, surgeon takes linear measurements using this vernier caliper, and angular measurements are taken using protector. They also have 3D. These 3D systems are available to take measurements if they do not want to use a protector and vernier caliper. And using this 3D system, patient's face is captured, converted into 3D model, and then distances are measured manually by surgeons from the 3D model of the which is constructed scanning the patient face. So here you can see that this instrument is used to scan patient face. Scanned images used to create patient's face 3D model, and then measurements are taken manually using from this 3D model. However, these 3D systems, they are very expensive, and the majority of the surgeons all over the world, they use this vernier caliper and protector to take facial measurements. Facial measurements means distance of, if we want to know what is the width of eye, what is the length of nose, what is the length of entire face, what is the width of face, what is the width of mouth. So these measurements are taken using this vernier caliper, and protector is used to measure angles on our face. Now issues in clinical craniofacial distance measurements are, if the measurements are taken using this devices, vernier caliper and protector, this is subjective in nature. Measurements are prone to manual errors and they are subjective. I may take measurement of eye as 30 millimeter and another surgeon may take 33 millimeter. Right? So in that case, I don't know. I mean, the surgeon who is taking the wrong measurement will not be able to reconstruct the original eye. Right? So this measurements are prone to manual errors and they are subjective. They are also difficult to take. It is also difficult to take accurate measurements of ruptured face area if a person has met an accident and if some part of face is ruptured, then it is very difficult to take accurate measurements from ruptured area of face. And if measurements are not accurate, reconstruction of original face is not assured by the doctors. And due to all these reasons, reconstruction of original face is not assured by the surgeons, and they ask patients relative to sign consent form before patient undergoes surgery. This is the example. This is Professor Mahesh Trivedi. He is my colleague. He is in he's teaching management subject. Some years back, he met a severe accident and he went through facial surgery. After drastic change in his facial features. This is his face before surgery and this is his face after surgery. Not be able to observe that extreme difference in his facial features. The difference in facial feature was so extreme that even I could not recognize him when he came to meet me after 3 months. So, in some cases, when patient's facial structure gets changed through surgery, and if that changed face is not appealing to patient down, patient may suffer from out in public, and hence it is very crucial to take precise measurements of areas to be operated. So to resolve this issue, we aim to develop an automated system to assist surgeons to get precise measurements and facial image. Our aim is to develop an automated system to to assist surgeons to get precise measurements, the spatial measurements from patient's image. So even if patient has met an accident and the facial part operated is ruptured and if surgeon is not able to take precise distances, surgeon will have precise measurements for that part from recent image of that patient. So moreover, so that is the aim of this research, and we have proposed solution to this problem considering secondary landmarks on our face along with primary landmarks. As I have told you, we have several secondary landmarks on our face, and if we consider face, we get smaller as well as accurate distance of all regions of face, definitely. Right, here you can see that these are the landmarks on mouth. So we can get smaller and accurate distances if we consider the secondary landmarks. It consists of four major steps. It consists of these four major steps: pre-processing, as I have told you, is to be operated for facial surgery. The patient's recent image is taken and that recent image is fed to this system. Then pre-processing is performed on the input image. This is resizing the image. Then face detection, the face is detected because only face is to be operated. Then the remaining part is removed and only face is extracted from the image. The next step is face landmarking and then distance measurement. During pre-processing step, resolution of original image is reduced to 300 cross 300 pixels to accurately detect the face. Then during the second step, face is detected from the input image and detected face is cropped and it is saved in database. During third step, landmarks are located on the detected on various parts of our face. And during the four steps, distance are measured the Euclidean distance formula. Chose two different solutions, one using pre-trained convolutional neural network. First, we developed this solution, but then we observed some limitations of this solution. So we proposed second solution using convolutional expert constrained local model, CLM model. So in this model, we use Viola-Jones 2 for face detection. Okay. Initially, we use, as I have told you, initially we use pre-trained convolutional neural network for face detection and facial landmarking. So this model, it extract features as well as it locate landmarks on the face. However, finally we use Viola-Jones algorithm for face detection and CECLM for face landmarking. The pre-trained convolutional neural network, it performs both the tasks, feature extraction and landmarking. But in second model, Viola-Jones algorithm is used for facial detection and CECLM is used for facial landmarking. For pre-trained CNN are this, and that's why we got motivated to develop second solution. These are the pros and cons of pre-trained CNN which we used. It was giving the pre-trained CNN model which we used for facial feature extraction and landmarking. It was giving fixed size bounding box. Moreover, region of interest detection was not supported. So if only one part of face is to be operated, like only mouth or only nose, then this model was not supporting detection of region of interest. So that's why I mean we had to process the whole whole face only. So that was the limitation of this pre-trained CNN based model. Moreover, it does not detect small faces. It is because it is trained for mini face size across 80 and it was very slow on CPU. So as we observed these limitations of pre-trained CNN based solution, we developed a second solution and these are the limitations of pre-trained CNN model. It excludes some exterior part of the face. Here you can see that in this it is excluding the exterior part of my face, right? This part is, especially it is excluding this part when the face is rotated. So here you can see that my face is slightly rotated and it was excluding that part. So if it is excluded, then I'll not get landmarks on that part and I'll not be able to take the measurements, right? Similarly, here you can see that this is occlusion on face. And in this image also is the bounding box is fixed, the some part of face is excluded, and here also in this some facial part is excluded. So this was the limitation, and if that part is excluded, we do not get landmarks of that part. Here I am not getting landmarks of forehead. You can see that forehead landmarks are missing because that part is excluded. Similarly, here you can see that some landmarks on this slide, they are not there because this part is excluded, right? So this was the disadvantage of pre-trained CNN based solution. So then we developed another solution in which Viola-Jones algorithm was used to detect the face. We can set the boundary of this box and you can see that entire face is detected because we set bounding box. And here also the exterior part of the face is not excluded. Exterior part is also included. And so we are getting all landmarks on the face. We are getting all landmarks on the face, right? Because we can set bounding box. Moreover, the advantage of this second solution is CECLM based model is it helps us to extract the region of interest. Here you can see that this is the entire face, but if only this part is to be operated, or only this part is to be operated, or if only this part is to be operated, or if only this part is to be operated, we can extract the region of interest. So this is the advantage of the second solution. This is Euclidean distance used to measure the distances between different parts of the face, and here you can see the measurements of different parts of my face. These are the different measurements in millimeter. Right? So how this solution will be useful to surgeons, that it will help surgeons to take accurate measurements from patient's recent facial image. So even if the facial part is ruptured, there will be no problem. They can take accurate measurements to reconstruct the patient's face. Moreover, the decisions will not be subjective, right? As I have discussed, when these measurements are taken manual, the decisions, these measurements may be subjective in nature, and there might be error in measurements. But when it is taken using the system, the accurate measurements will be taken. Though this is the solutions proposed by us, it is giving the correct measurement also. It is, but it is not able to find correct measurements in some situations, like when face is rotated extremely, when image is having different illumination conditions, when facial image is ruptured. We have yet not tested for ruptured facial images, and when face is highly facial image. So for this conditions, we have not checked whether this approach is giving correct measurements or not. Moreover, we can improve results considering 3D facial images. So far, we have considered 2D facial images. We can convert 2D, we can add one step in the solution. We can convert that 2D facial image. After extracting facial image, we can convert that 2D facial image into 3D facial image. It will facilitate accurate measurements as well as angular measurements also. So this work can be extended this way in future. Okay, this is a second application. It is to detect dry eye disease. Dry eye disease is a common and a widespread eye disease in the world today, and it is growing health problem which affects significant percentage of population all over the world. It occurs due to instability in tear film, right? In our eye, we have tear film that regularly produces tears. So reduction in tear production or abnormality in tear film, tear producing glands, that results in dry eye disease. This is human eye. This figure shows the anatomy of human eye. It is divided into two major parts. As you can see, this is anterior segment and this is posterior segment. And a transparent structure is situated in front of eye. This is the transparent. You can notice that this is the transparent structure situated in front of the eye, and it is referred to as cornea. It is referred to as cornea, and in order to keep our eyes healthy, cornea should be kept moist. If we to keep our eyes healthy, this cornea must be moist. And a tear film is located on cornea. A tear film is located on top of this cornea. It helps to fulfill this need. It keeps our eye moist. Related to this eye, there are several diseases related to eye, related to anterior segment. These are the diseases, eye diseases, and related to posterior segment of eye. These are the various types of diseases. Our focus is among these diseases, dry eye is the most commonly occurring disease that is caused by instable tear film on cornea. Our focus is on this dry eye disease. Focus is on dry eye is because 37 to 47% of all patients who visit ophthalmologist and optometrists, they visit. Moreover, this is a problem today, and dry eye is common but still an often overlooked condition. It is progressive disease, and patients with severe dry eye, they rank their degree of suffering as much as severe angina and dialysis. So this is very critical disease. However, it is often overlooked condition. As prolonged use of electronic gadgets, old age, environmental environmental conditions, medication, smoking, right? Then use of contact lens, they your film balance and they can lead to evaporation of moisture from your film, which causes dry eye disease. These factors they disturb tear film function, and when tear film function is disturbed, it produces tears in less amount and it disturbs tear film and it causes dry eye disease. Symptoms of dry eye disease include blurred vision, burning sensation, sore and itchy eye, then the photophobia, right? Excessive tearing, dryness sensation. So these are the symptoms of dry eye disease, and often this symptoms, when we have these symptoms, they are overlooked. If this disease, if dry eye disease is treated, it can cause infection, corneal ulcer, or it can also cause blindness. So it is highly required that this disease gets treatment on time. There are several clinical tests to identify dry eye disease, to diagnose this dry eye disease. These clinical tests are mainly categorized into two categories. Tests based on quantity of tears produced and tests based on quality of stereofilm. So these are the two types of, these are the two categories of tests. These are the tests, they measure quantity of tears, and based on quantity of tears, ophthalmologists take decision that patient is suffering from dry eye. These are the different instruments which are used to measure the quantity of tears. These are the tests performed. These are the tests used to check the quality of tear film, and checking the quality of tear film, ophthalmologist decides whether patient is suffering from dry eye disease or not. Now, these tests are performed taking into consideration eye image or eye video. So these are the tests which analyzes quality of the tear film and patient is suffering from dry eye disease or not. Among these tests, TB tear film breakup test. Breakup test is most common test used by ophthalmologists in clinics because it is cheap and easy to perform. However, it is performed manually today. So our aim is TBUT test. Okay, let me first tell you that how this TBUT test is performed in clinics. This TBUT test measures the stability of the tear film. So what exactly is done in this test by ophthalmologist? In this TBUT test, fluorescein drops are instilled into patient's eye, and then patient is asked to spread this fluorescein drops all over the eye, and then entire area of spread over the this fluorescent drops, patient is asked to spread this fluorescent drops over the entire area of eye by blinking the eye few times, and subsequently the ophthalmologist observes. Here you can see that after that ophthalmologist observes this tear film using slit lamp. This is the slit lamp which is available in every ophthalmologist clinic. So this slit lamp is used to observe the tear film, and this ophthalmologist measures the time in seconds at which the dark spot first appears on the tear film. So here you can see in this figure that this is the dark spot appears on the, this is the dark spot appears on the tear film. So after instilling this fluorescent drops, the patient's eye is observed, it is analyzed by ophthalmologist using slit lamp, and ophthalmologist checks whether there is dark spot available on tear film. The appearance of this dark spot, shows the instability of the tear film, and if it is there, then dry eye disease is detected. then dry eye disease is detected. This is how the manual test is performed. If time is less than 5 seconds, it indicates severe dry eye disease because, as I have told you, ophthalmologist analyzes this tear film and checks that after how much time this dark spot appears on the tear film. If it appears, it appears before 5 seconds, after 5 seconds, right? So if the time is less than 5 seconds for this dark spots, it indicates severe dry eye. If the time is between 6 to 10 seconds, it indicates moderate dry eye disease. And if the time is greater than 10 seconds, that is, if dark spot appears, it indicates there is no dry eye disease, it is normal eye. So here you can see that this is video. Now you can see that time will be measured. Now you can see that dark spot appears after time. So this time is measured, that how much time these dark spots appear on this tear film. If they appear in 5 seconds, then we can say that patient is suffering with severe dry eye disease. So this is how this is performed by doctors in clinics. Limits of manual PPT tests are there. It is time consuming because the fluorescent drops are instilled into patient's eye. The patient is directed to spray those drops over the entire area of eye. Then patient's eye is observed. It is analyzed by ophthalmologist using slit lamp. So it is time consuming, and diagnosis is done and diagnosis done by ophthalmologist is subjective in nature, as it depends on the observer, right? I may observe dark spots after 5 seconds, and another ophthalmologist may observe that dark spot after 7 seconds. So in that case, severity level may change. So okay, fine. And okay, so that is the problem. So we aimed to develop and computer aided TPUT. We aim to develop a computer aided approach to diagnose dry eye disease, and the benefits of this automated diagnosis would be there would be decrease in subjective variability. Then we can classify severity of disease also correctly, and the faster diagnosis during the mass disease in a government hospital and multidisciplinary hospitals. So this is this would right our approach, our system would assist ophthalmologists for accurate dry eye disease diagnosis. It will help ophthalmologists to detect DD in less time, and TBUT will be taken. The video will be taken using slit lamp only. So, no extra or special instrument is required to take the video. Proposed solution, here you can see that in this solution, we have trained, we consulted several ophthalmologists. Few of them could provide us TBUT videos due to that privacy issues. They all could not help us. So few doctors, few ophthalmologists, they provided us TBUT videos. We trained our model using this TBUT videos, and these are the various steps in development of this approach. That these are the TBUT videos. They are divided into frames. These frames are then pre-processed, they are resized, and those frames are enhanced in quality. Then these features are extracted using CNN from these frames, and using these features, you can see that based on the features, the frame is divided into 4 categories. And these 4 categories are the frame is normal, the frame may indicate breakup area, the frame is invalid frame because the person has during that part the person has blinked the eyes, so it is not valid frame, it is not valid part of the video, and it may be noise frame also. So based on feature, these frames are divided, this video frames, video means it is eye video, it is tear film breakup test video. So this video is eye video of the patient, right? Patient is directed not to blink the eyes when this video is taken using the slit lamp. If patient blinks the eye, video is taken again. So that disadvantage when this test is performed manually. So these videos are divided into video frames. These frames are pre-processed, they are extracted, and based on expected features, they are divided into these 4 classes. Then this same model, it is used to detect the dry eye disease from patient's TQT video. So when the testing is also performed with the videos collected from the ophthalmologist, in the same steps are performed. Video frames are created from the video, are pre-processed, features are extracted, and then those from if detected, are the 4 classes. So if any breakup frame is detected, result. So actually these frames are created at every 1 second. So frame number represents the seconds, that this is the frame after how many seconds. So the time, if any breakup frame is detected, then that breakup frame number is not, that breakup frame number is taken, is considered as the time at which the breakup appears first. So if that time is less than 5 seconds, then severe dry eye disease is declared. If it is between this, moderate dry eye disease is declared, and if it is greater than 10, then it represents normal eye. So this is implemented. This is implemented in MATLAB, and we tested this trained model with 10 videos provided by ophthalmologists. So here you can observe the opinion of ophthalmologist, and because it is labeled data, so this is the opinion of ophthalmologist, is the output produced by our proposed approach, which is developed using deep learning. So for some of the cases, we were not getting the correct results, but we are not sure that whether it is manual error, because this is the time measured by ophthalmologist, and this is the time measured by proposed approach. So there may be error in a manual measurement also, and there may be wrong output declared by our proposed approach, but this is the output given by the proposed approach, and this is the output, this is the opinion, this is the ophthalmologist opinion, right? So here you can see we checked for 10 classes, right? Total 10 videos, not classes, for 10 videos. And based on the identified breakup frame, we also determined the severity of DED detection. So this is the result of those 10 videos, right? Here you can see that our result is not matching the ophthalmologist opinion. However, we got 80 plus percentage accuracy, 84 percentage accuracy we got, right? So here you can, the point here is there are such several diseases which are unexplored, and they are rarely focused for the research. You will not find more than 2 to 3. The first paper related to this you will find in 2007, and then 13 years you will hardly find a paper which is on computer aided diagnosis of dry eye disease, right? So you can carry out research on such unexplored diseases. These are rarely focused, but to get data you have to consult, as these are the diseases rarely focused in research. You will not find any data online. No public data is available for such diseases, right? So you have to consult doctors, and you have to take their help. Moreover, for basic understanding of this disease, also we consulted different ophthalmologists to make our fundamentals strong in this domain. The next use case of artificial intelligence in healthcare. This is the early detection of hypothyroidism in infants using deep learning. As we all know, thyroid is a hormone secreting gland which influences all activities in our body. Deficiency of thyroid hormone at birth, it leads to thyroidism. Right? There are different types of thyroid disorders. These are the different types of thyroid disorders. One of the type is hypothyroidism, and hypothyroidism occurs in infants as well as in adults. So the common hypothyroidism symptoms in infants are prolonged jaundice, protruding tongues, then hoarse crying, puffy face, pain and swelling in joints, goiter, etc. But they are, so even if they have some difficulties, they are not able to communicate with us about their problems, and it's difficult to identify hypothyroidism in infants. During the early stage of hypothyroidism, babies may not have symptoms. Right? As I told you, they may have prolonged jaundice, or they may have protruding tongue, right? But and they may have puffy face too. But these symptoms, they are not proficient during the early stage of the hypothyroidism. They are not noticeable, and hence doctors, they face difficulty in recognizing hypothyroidism in infants. Therefore, complications such as, if this hypothyroidism is not identified in infants, then severe complications may occur, and such complications include mental retardation, slower linear growth, loss of IQ, then poor muscle tone, sensorineural deafness, speech disorder, vision problem, and they may arise due to which infant's growth may not proceed as healthy infant. So hypothyroidism must be treated on time in infants, otherwise such complications may occur. Such some complications are like complications not be recovered later. So clinical, let me first tell you that how this hypothyroidism is diagnosed in clinic. The patient's history is collected and then physical examination is carried out. As patient's history is collected from infant's parents, and then physical examination, knowing the history, physical examination is carried out, like facial features are observed, then tongue is a protruding tongue or not, whether goiter is there or not, so whether the skin is dry and pale or not. So physical examination is carried out, and however this diagnosis is lengthy diagnosis process, and diagnosis from physical examination is very subjective in nature, right? And in many cases, this hypothyroidism, though infant is suffering from hypothyroidism, it is not identified by pediatricians. So this problem statement is also identified in consultation with few pediatricians in Surat, and then we collected data from pediatrician in Surat and pediatricians in Ahmedabad. However, let me tell you that this data will not be available with pediatrician. This disease is identified when pediatricians are not able to identify this disease, and then they recommend parents to consult endocrinologists. So there are pediatric endocrinologists. So this is one higher level specialization that these pediatricians, they may be pediatric endocrinologists. So we consulted pediatric endocrinologists, and pediatric endocrinologists you will not find in every city. Only major cities will have such doctors. So pediatric endocrinologists are available in only like 4 major cities of Gujarat. They are available in Bombay. So we consulted some pediatric endocrinologist of Mumbai also, and I consulted some pediatric endocrinologist of Ahmedabad and Surat. In Surat, I could find only 2 to 3. I attended through recommendation of one pediatrician. I attended one meeting of pediatricians, and there I was introduced, and then they helped me to provide data of infants who are suffering from this hypothyroidism disease, because when I want to create automated system, I need data to train my model, machine learning, deep learning based model. So to train my model, I need label data. This label data, if it is not available openly, then I need to consult, I need to collect it from doctors only. So I consulted them, and some of they could not provide here also because of privacy issues, because they need to take consent from the patients, and some of they could help us, and I guarantee them that we will not disclose this data and we will not make them publicly available, and we will use this data for research purpose only. Moreover, the main problem we faced here is when we had meeting with pediatricians, they guided us that we could develop a system to identify this hypothyroidism in infants through infants facial image. Now, actually, they observe they observe when they identify manually, when they identify hypothyroidism in infants manually, they observe these features manually on infant's face. And here you can see that these are the features of his face, right? If he is suffering from jaundice and yellow skin, right? Swelling around eyes, right? This is protruding tongue, and this is flat bridge nose with broad fleshy tip. So these are the features observed manually, and as I have told you, some features are not prominent during the early stage of hypothyroidism, but we want to identify hypothyroidism during early stage so that this infants can be saved from those complications, right? So they guided us to develop a system to identify this hypothyroidism from facial image of infant, but there was no point that no pediatrician, they were, they did not take any facial image of their patient because they otherwise would need this facial image. So on our request, they took facial images and they provided us facial images of infants who are suffering from hypothyroidism. Moreover, we also collected facial images of infants who are healthy, because we have to train our system with positive as well as negative samples, then only it will be able to correctly produce the results. So we collected these results and we collected these images from pediatric endocrinologist, and with these images we trained our model. Here you can see that they provided us image. We extracted faces from these images because we want to identify hypothyroidism from facial image. So faces are extracted here using this model MTCNN, and then features are extracted from the faces, and then based on these features, two classes are created: healthy and hypothyroidism. So this trained model is then used to test the new images, wherein we provide the image, face is detected, features are extracted, and based on these features, the probability is calculated. So if it is higher than 0.5 and if it is lower than 0.5, then we have two classes, healthy and hypothyroidism. So these are the test images we performed, and for some of the images we are getting correct results, and for some of the images our results are not matching with the doctor's opinion. So you can see the results here, and this is the accuracy we got. We got this accuracy, 80% of accuracy with this model. So these are the three case studies. Here I would like to again tell you that there are several research opportunities, but you need to find out the unexplored area, the rarely focused diseases, and then you can carry out research in association with doctors in that field. As I have told you, for dry eye disease, we consulted ophthalmologists. For this hypothyroidism detection, we consulted pediatric endocrinologist, and such diseases. For that craniofacial distance measurement, I was in association with some plastic surgeon as well as some other surgeons, and they provided us fundamental information in their area. Moreover, they also helped us in testing, and they also helped us in providing data. Okay, so after discussing this use cases. Now I would like to present challenges and enormous future opportunities in this domain. AI along with data AI along with data science has brought several benefits to the healthcare industry. However, healthcare industry is still facing significant technical and non-technical challenges in development and deployment of AI-powered applications. So these are the key challenges that must be addressed carefully for the successful deployment of artificial intelligence in healthcare. Uh, there is a lack of centralized data set that comprises of patient data from different regions of the world or from different countries. As I told you, for our research, we collected data from Gujarat state. However, if I want to develop competent model, then I need to collect data from different regions of India or from different parts of from different regions of country. And centralized data set is required because, for example, if we discuss about the images, or if we discuss about the CT scans and MRI images, then different radiologists, they have different instruments. Those instruments, they are different in configuration and specifications. Some radiologists may be using old devices to capture CT scans and MRIs. Some radiologists, they may be using advanced technology to capture the CT scans and MRI. Now, if you collect the CT scans or MRI images from radiologist who is using old devices to capture this data, then configuration and specification of those images are different, and those images contain different types of different information. And if you are training your model with only those images, then your model will be able to detect diseases only from those type of images. If you feed an image, if you feed city image taken with latest device, then your model may not be able to correctly diagnose from your image because it has not been trained with that different type of image. So it is always recommended that when you create a data set or when you train your model for disease diagnosis, you should have data collected from different regions of your country or different regions of world. Data, because data vary largely due to several factors. Just I discussed one reason that why quality of data is different, why the data vary largely, right? Because they are collected from different laboratories or different, yeah, even if it is a pathology data, and if you collect the data from different laboratory, they have different variables. If it is CBC report, then different laboratories, they may have different factors for that report, right? And that's why it is always recommended that do not collect data from only one doctor or only one laboratory. You should collect data from different doctors and different laboratories, right? Because those data they vary largely with respect to number of factors and information. And to create competent model, machine learning or deep learning model, to create competent AI model, you should train your data with you should train your model with variety of data. Lack of sufficient annotated data. This is very important. You collect data or you may have data, but they may not be annotated. We collected TBUT videos from ophthalmologists and we requested those doctors to annotate those video frames, because then we cannot, without annotation, we cannot train our models able to identify that what is eyelid and what is eyelashes and what is cornea and all, right? So if we want our model to identify that what is eyelid, what is eyelashes, what is cornea, what is a tear film, then those parts must be annotated in those images. Because annotation, okay, so lack of sufficient annotated data, because annotation requires expert advice, which is cumbersome, right? We cannot annotate data. We need experts to annotate that data. We need to take help of medical technicians. Annotation is essential to claim significant results. The next challenge is imbalanced data. As I discussed earlier, you have to train your model with positive as well as negative samples, right? If it is hypothyroidism detection, then I cannot train my model only with facial images of infants suffering from hypothyroidism. I also need to train model with facial images of infants not suffering from hypothyroidism or who are healthy, because then only the model will be able to differentiate between healthy facial images and facial images showing hypothyroidism features, right? So, but in many cases we have imbalanced data. We do not have positive and negative data in equal amount. And if we do not have positive and negative data in equal amount, then it may produce inaccurate results. Ideally, data should have nearly equal number of positive and negative samples to avoid accuracy paradox, right? So this is very much important. The next reason is patient privacy and the ethics of data ownership, and that is why data we are not getting, and that I too experienced when I tried to collect data that they are bound to provide limited data, bound to provide data taking consent of patients. So I designed one consent form and I requested them to get that consent form signed from patients. And I assured them that we will use this data for research purpose only, because the patients do not want to display their facial images. Okay. Of machine learning and deep learning models due to limited data and or due to limited annotated data, right? So yes, if we do not have sufficient data, then we cannot provide satisfactory training to our machine learning deep learning models, and in that case we won't be able to. Sometimes data is in sufficient quantity, but it is not annotated. So if we have either of this problem, we will not be able to train machine learning, deep learning models, and those models may not produce accurate results. Validation of AI-driven healthcare application in other regions of the globe to prove its competency and effectiveness. Yes, validation of AI-driven healthcare application. So once we develop healthcare application, we need to validate it in other parts of country or other parts of globe to declare that application as the competent and effective application. How to modify existing algorithms and take benefit of previous training on large data set, that is also a challenge, right? That existing solutions can be modified, existing healthcare solutions, AI powered healthcare solutions, they can be modified, and they can take benefit of previous training on, and we can take benefit of previous. So we can train those models with new data or with new analytic techniques. This is the most significant challenge, lack of interpretability when you use deep learning black box model with multi-layer nonlinear structure, because it gives results with no explanation, right? Suppose we have developed an automated system for cancer diagnosis, and suppose that model has diagnosed that patient is suffering from cancer, but it gives result yes or no, whether patient is suffering from cancer or not, yes or no. It does not provide any result. It does not provide any explanations that that enable doctors to trust on that system, right? So it leads to lack of trust because no explanations are provided, and that's why doctors are not accepting of AI-based solution. They do not trust results produced by AI-powered systems because they provide systems without results without explanations are not accepted by medical experts. There is a system which is designed to identify or to diagnose lung cancer. So it should that system should give results, that why that system has identified from medical image of lung that patient is suffering from lung cancer. So it should give the results that due to which features or due to which affected area of lung that automated system has identified that patient is suffering from lung cancer. So reasons are required. And for this today, if you have heard, researchers are using the concept of explainable artificial intelligence. It is known as XAI. Explainable artificial intelligence, it is known as XAI. It is used in medical healthcare to provide explanations. Existing machine learning, deep learning model is not sufficient. This is also a challenge. We can take measures to increase accuracy of existing solutions. Lack of association between medical experts and machine learning scientists. And I too believe that association is required, and without association between medical experts and without association with medical experts, we cannot carry out fruitful research in this domain. Because if this research is carried out only by medical experts using AI techniques, then they are not expert in technical stuff, and they are expert in medical domain, so they cannot do fruitful research. Similarly, technical experts, they have technical knowledge, they have a knowledge of all the technical domains, but they don't have expert knowledge in medical field, and so they alone can also not perform fruitful research. So there must be association between medical experts and machine learning scientists. Close association between them can further advance this field. Design of solution application that can be smoothly implemented and integrated into clinician practices and patient care is required. And design of global solution is also required. This design of global solution is possible only if you collect data from different regions of the country. So global solution means it should be a solution across population, across institutions, across scanners, across countries, etc. Scanners means these are CT scanners or MRI scanners. So for any kind of, if it is a scan, irrespective of type of scanner, if you provide MRI or CT scan, it should produce correct results. So these are the various challenges in this domain if you want to carry out research. Opportunities, future opportunities. Though machine learning and natural language processing, they have brought significant challenges. They have brought significant changes in several sectors of healthcare. The future of AI in healthcare unfolds several opportunities over next few years. AI-powered solutions have made small footsteps towards addressing primary challenges. However, still, we have to achieve meaningful overall impact on the global healthcare industry. And present opportunity researchers can contribute are we can use transfer learning data augmentation techniques. They can help overcome data dearth, transfer learning and data augmentation techniques to increase the amount of data. And transfer learning can also be used. We can also use GAN, generative adversarial networks, to increase the amount of data, or use traditional data techniques. Careful selection of data can help improve accuracy of machine learning models. So careful can help improve accuracy. Yes, selection is required, like equal amount of positive and negative data. Moreover, if that data includes a high amount of noise, then it would not be much useful to train our model. So some factors we need to consider while we are selecting the data. Automated models can be created to produce medical images, right? You must be knowing that when we go to radiologists, they have sonographers, and those sonographers, they analyze X-ray they produce that text report for a medical image. So we can create automated models, and those automated models can be used to produce those text reports from medical images accurately. So in that, sonographers are not required. Efficient algorithms can be developed, or we can produce, and then sonographers can verify those reports generated by the machines. Efficient algorithms can be developed to generate annotations in medical images. Like as I told you, experts are required when we want to annotate medical images. So, but however, it's very cumbersome job. They don't have, if we have a huge amount of data, right? They cannot, I mean, they cannot spend that much time to annotate that huge amount of data. So we can create efficient algorithms to generate annotations in medical images. Okay, then algorithms can be developed to detect such as MRI, X-ray, CT scan, etc. Applications can be designed to convert reports to voice for blind people. Medical image fusion of two modalities is recommended. This is also very popular area for research, like for navigation of brain tumor. In spite of using only one medical image modality, different medical image modalities can be used, like pre-operative medical image and intraoperative medical image. So pre-operative may be CT scan and intraoperative may be MRI. And this different types of medical image modalities can be combined, they can be fused to navigate brain tumor. So this concept is useful for several types of disease diagnosis. Then explainable models need to be created for medical image analysis. As I told you here, we can use XAI, explainable artificial intelligence, to create models which will provide explanation along with decision. And optimization of hyperparameters in neural network needs to be taken care. So if you of this setting of this hyperparameters, they also help to produce correct results and correct and accurate results, right? So these are the various opportunities available in this domain. So this is all from my side. Now, if you have any query, I would like to take your questions. I'm using mobile data and my mobile battery is running, it's running low. So probably I may get disconnected after 5 minutes because I was facing my internet connection in the department. So I'm using mobile data and mobile battery is running low. So if you have questions, then please, let me know your questions. Can discuss.
Participants, any questions? Yes, madam, your case studies were very good. Very nice case studies you have presented. Madam, can you remove sharing? We will
So I'm
show.
excited.
Yeah. Sony, madam.
Much everybody for patiently hearing, and I'm very sorry
Yeah.
for interruption due to technical problem.
So we had some hurdles initially, but we can't do anything about the technical difficulties. But apart from that, ma'am, your session was good, and all the case studies, all the examples which you have showcase over here were excellent. So we have learned different kinds of example that you have incorporated in your presentation, starting from the AI for healthcare, how it is increasing, how it is impacting the medical industry, including the early detection and the accuracy of that, how we can do the treatment variability, care processes, all those techniques, all those case studies which you have included were excellent, ma'am. So thank you once again for all your efforts that you have took while conducting this session. So thank you once again, and please accept this virtual memento from the organizing team.
Thank you very much, ma'am. Thank you very much. Thank you, Surendra sir.
Thank you, ma'am. Thank you. Today you had a lot of challenges, technical challenges, but finally, anyway, you are able to complete the session. You are able to deliver. We are happy about you.
Yeah, yeah.
Yeah, yeah,
Thank you. Thank you.
yeah. Thank you, ma'am. Thanks a
So
lot. Thanks a lot.
I'll leave the meeting now. Yeah,
Yeah,
thank
yeah,
you,
yeah.
sir.
Yeah, thanks a lot. So participants will meet evening 5 p.m. Mr. Pawan Phakatkar will be there from KPIT. He will be taking us through the autonomous driving, an example of autonomous driving. So thanks a lot. Thank you very much. So I'll close the meeting now.